to increase the surface area. To increase the surface area, first you have to reduce the particle size. Okay. So, if you reduce the particle size, then the surface area will increase. So, what is the correct answer in this? Size reduction. Distillation, filtration and evaporation, all these are separation techniques. Only the size reduction is a reduction technique. When you reduce the particle size, surface area will increase. Next question, which of the following factor affects the stability of the pharmaceutical package in a plastic containers? So, if you are packing in a plastic one, so what is happening? What are the factors which will affect its stability? So, permeability to moisture, leaching, next sorption. Okay. So, all the above. So, all will be affected if you are packaging in a plastic container. Permeability, moisture means moisture will enter. Next, leaching of plasticizers. Whatever the plasticizers are there, they will spread from one to the another. Okay. Sorption means absorption of a drug molecule. So, all this will be affected. So, the correct answer is the all the above, D. Next, third question is, which of the following is considered a disadvantage of a plastic packaging for the pharmaceuticals? Okay. So, what is a disadvantage if you are packaging in a plastic? Brittle nature at low temperature? No. Permeability to gases and moisture? Yes. High weight compared to the glass? No. Resistant to impact? So, the correct answer is permeability to gases and moisture. Already we have studied in the second bit. So, whenever you are packaging in a plastic, sorption, leaching, next moisture absorption, all this will occur. So, the permeability to gases and the moisture is the correct answer, option B. Next one is the functions of the skeletal muscle. Okay. First, what are the functions of the skeletal muscle? They have given, but you have to choose the wrong answer. First one, giving body shape, this is a function. Okay. Helping to move, yes. Protective the organs, yes. Muscle strength, no, this is not a function. So, what they have told you, choose the wrong answer, the option D, that is a muscle strength. Next, adults have a bones in their body. So, how many bones are present in your body? 207, 270, 202, 260. So, the right answer is the 206 bones are present in your body. The option is B. Next, function of cartilage in the body is. So, what is the function of the cartilage in your body? First one, connect the bones to bones, that is not a primary. Okay. Next, connect muscle to bone, no. Next, shock absorber in the joints through the body, okay, yes. So, the correct answer is C. It will act as a shock absorber in your joints. Okay. If there is a degradation of this cartilage in your body, then you will have a pain in your joints. The following all are respiratory diseases except, so which is not a respiratory disease? Tuberculosis will spread, okay. Next, chicken pox, influenza. So, tetanus is a correct answer. The option B is a tetanus. Next question, tuberculosis is mainly spread by droplet infection, yes. Cough, yes. So, the correct option is option A and B, that is a C. D is direct transmission, no. Mainly if you are present beside any person suffering with TB, through this is a main mode of transmission, that is a droplet infection as well as through the cough. Next question, example of a communicable diseases, okay, which will spread, okay, in a community. Respiratory infections, yes. Intestinal, yes. Next, sexually transmitted diseases, yes. So, all the above. Option D is the correct answer. Next one, choose the tuberculosis second line of drug, means there was a first treatment of a drug, but there was no effect by the first chosen drug. So, they have shifted to the second line of a drug. So, what is in a second line of a drug? Ethambutol is first, pyranizumide is a first, Next, ethionamide is a second, rifampin is a first. Okay. So, what is the correct answer? What they have told you to choose? Ethionamide. That is a option C. Next, isoniazid inhibits the synthesis of. So, this particular drug will inhibit, okay, it will act on the microorganism, but how it will act? So, what is the synthesis? So, synthesis of mycolic acid. All these are wrong answer. It will not act on RNA synthesis, DNA, protein synthesis. So, synthesis of mycolic acid is correct. Next, mechanism of rifampin. So, what is the mechanism? How it will exert its therapeutic action? First one, it binds to the bacterial DNA dependent RNA polymerase. Yes. It will inhibit the bacterial cell wall synthesis? No. It inhibits the arabinosal transferases enzyme? No. It inhibits translation in Mycobacterium? No. So, the correct answer is A. It binds to the DNA dependent RNA polymerase. This enzyme, it will act on that and it will inhibit that. Next, it is the state produced when a patient receives medications for amnesia, that is a memory loss, analgesia, pain, muscle relaxation and sedation. Laxatives? No. General anesthetic? Yes. Hypnotics? No. So, the correct answer is the option B, that is the general anesthesia. Next, following all are the benefits of anesthesia except, okay, sedation and reduced activity? No. Means this is a correct answer. What you have to do? You exception. All are correct, but there is a one wrong answer. Lack of awareness and amnesia? Yes. Next, confusion and memory loss? No. Skeletal muscle relaxation? Yes. Okay. So, if you are taking an anesthesia, this will happen. But only there will be no memory loss or there will be no confusion. So, this is a exception one. Option C. Next question. Example of a benzodiazepines. So, they have given a list of drugs, you have to identify. Diazepam, it is a benzodiazepine. It is a benzodiazepine. Lorazepam, if you see all zepams or zolams will contain the benzodiazepines. Okay. So, correct answer is the all the above, that is the option D. Next. These are the substances which precipitates the protein. Means if you add this substance to the protein, ultimately denaturation or precipitation of protein will occur. Antacid? No. Astringent? Yes. Expectorant? No. Catharetase? No. Okay. So, the correct answer is the astringent. So, whenever you add a astringent, the protein will undergo complete precipitation. Next, astringents are used for, okay. So, what is the purpose or in which preparations they are used? Antiperspiration preparations? Yes. Okay. Mouthwashes? Yes. Eye drops? Yes. So, all the above. Correct option is D. Next one. Which method of sterilization is commonly used for a heat sensitive solution such as eye drops? Okay. For eye drops, what is the mode of sterilization you are using? They are heat sensitive, thermosensitive. Dry heat sterilization? No. High temperature is there? It will decompose the drug. Filtration sterilization? Okay. Autoclaving? No. High temperature for next. Gas sterilization? No. Okay. So, the correct answer is the filtration sterilization. So, the membrane filters, by using 0.45 micron filters, you can prepare the eye drops. Next, mechanism of aspirin. So, the main mechanism of aspirin is, it is an anti-inflammatory, but it blocks both enzymes, COX-1 as well as COX-2. So, it will affect the pathway of both. So, the correct answer is the first one. So, irreversible blockage of COX-1 and COX-2. Next, which one is not a salicylic acid derivative? Okay. So, out of these four, aspirin is salicylic acid derivative, the other name is acetyl salicylic acid. Salicylate, it contains diflunisol, no. Paracetamol also it will have. Okay. So, the correct answer which will not contain the salicylic acid derivative is the option C. Next one, mefenamic acid is para-aminophenol derivatives, no. Salicylic acid derivatives, no. Anthranilic acid derivatives, yes. Okay, so the correct option is C option. Next, the following all are important of reducing the particle size except, okay, it increases the reactivity of solids, yes. It permits the separation of unwanted ingredients, yes. Increases the contamination, no. It reduces the bulk of fibrous materials for easier handling. So, this is an exception for the particle size. So, whenever you reduce the particle size, it will not increase the contamination. It is a wrong answer. Means, in this your question exception is a correct. So, C is the correct option. Next, choose the advantages of the size reduction process. Okay, content uniformity, desired size, uniform flow, avoid weight variation. So, what are the advantages of size reduction? Yes, content uniformity is there, desired size already whatever is there you will get it. Uniform flow, yes. Avoid weight variation, no. So, A and C are correct. So, what is the option? A and B, B and C, A and C. So, C option. Third option is the correct, A and C. Next, this is the mechanism of particle size, okay, reduced by a single rigid force. So, by applying one time force, you are reducing the particle. Compression, no. Attrition, no. Cutting, no. Impact, S. So, the correct answer is option D, that is the impact. Next, it can be thought of as a transport system of the body out of all the system. Respiratory system, no. Urinary system, no. It is a excretory system, okay. Next, coming to the third option is a cardiovascular system. Cardiovascular system is nothing but heart. So, what the heart does? Pumping, okay. Transport of a blood or the circulation of the blood. So, the correct answer is the option C, CVS system. Next, these are the blood vessels which carry the blood from the body back to the heart. So, reverse. So, veins, yes. Arteries, no. Capillaries, no. Okay, so the correct answer is the option A. Next, what is the function of a capillaries in the heart? To prevent the backflow of blood? No, this is a function of a vein. Next, to connect the arteries and the venules and to distribute the nutrients. Yes. To control the heart rate? No. To the blood flow? No. So, the correct answer is the option B. Next, mechanism of a size separation except. So, all will happen except. What is the mechanism of size separation except? Okay, agitation, okay, brushing you can do, attrition, no, centrifugal, yes. Attrition, it will be done in case of size reduction process, but not in a size separation process. So, exception is a C, that is a attrition. Next, sieve number 22 has a nominal mesh aperture of. So, if you see in your subject physical pharmacy, they will give a sieve numbers and the aperture size. So, you have to by heart the table of a sieve numbers and the aperture size. So, the correct answer for this is 355 no, 260 no, 180 no, 710. Okay. So, this particular sieve will have a mesh aperture of 710 mm. Okay, next question. The method of separating the powders on the basis of their density. So, based on the density, you are separating the powders. So, what the process is known as? Sedimentation, no. Elytration, yes. Centrifugation, no. Based on the force, it will be separated. Compression, no. So, the correct answer is the option B. That is a elytration. Based on this one, we will separate the powders based on the density. Achlorhydria, okay. Chlor is nothing but presence of a chloric acid. Aclo means removal or the less. So, what is the correct answer? Absence of NaCl, no. Presence of HCl, no. Absence of HCl, correct. Presence of HCl, no. NaCl. So, achlorhydria means if there is a decreased secretion of hydrochloric acid in your stomach, then it is known as achlorhydria. Next, the excessive secretion of a gastric HCl. So, earlier question was less secretion. If there is a more secretion, what it is known as? Okay. hyperchloria. This is the correct. Hyper means more. As I have told you, chloria means production of a HCl is known as the chloria. So, the correct answer is the A option. Hyperacidity no, hyperacidity no, hypochloria no. Hypo means less, hypo means less, hyper means acidity. Acidity is nothing but it is not related to the HCl production. So, HCl production is known as chlorhydria. More excess, hyper. Less, hypo. If there is no production, then it is known as echlor. Next question. The chemical form for kaolin is, so the chemical name for kaolin is aluminium silicate hydrate. Okay. So, if you see in all the options, aluminium silicate is there. Aluminium silicate means Al2O3 is aluminium, silicate means SiO2. So, it is which hydrate? Okay, it is dihydrate. The fourth option is rolled out, Al3. Okay, trialuminium. So, it is not correct. Out of these three options, okay, which is a correct one? It is a dihydrate moiety. So, the other name for kaolin is aluminium silicate dihydrate. So, Al2O3, 2 molecules of SiO2 and 2 molecules of water. Next, which plants are used as a cardiotonic drug? Means which will affect or on your heart, or which will show the absorption or action on a heart. Digitalis S, Arjuna S. So, both options are correct. The correct answer is option C, A and B. Next, these are the drugs which are used to increase the efficiency and to improve the contraction of the heart muscle. Okay, astringents, no. Next, cardiotonic, yes. Antiarrhythmias, no. Anti-anginal, no. So, these are the drugs which are used to increase the efficiency and improve the contraction of the heart muscle. So, the correct answer is the B, that is a cardiotonic. Next, choose the wrong chemical test for the digitalis. Okay, Keller-Kilani test will be performed. Yes, legal test will be performed. Biuret test, no. Baljet test will be performed. So, which is the wrong answer? You have to identify. Answer C, that is a Biuret test. Next, it relieves the pain as a symptom without affecting its cause. Okay, pain will be decreased. Okay, only that will be done. There will be no other extra benefit or the effect. Okay, sedatives, no. Spelling mistake, there is. Okay, E. Sedatives, no. Analgesic, yes. Analeptics, no. So, the correct answer is the analgesic. These are the agents which will reduce only the pain. It will not have any further action. Next, the following all are the opioid analgesic except. So, the following all are opioid analgesic except. Morphine is an opioid analgesic, tramadol is an opioid analgesic, diclofenac is an anti-inflammatory drug and pethidine is another category. So, the correct answer is the diclofenac. Okay. So, if you see all are the opioid analgesic, only the diclofenac is the odd one in this one. So, the correct answer is the C option. Next, match the following analgesic as well as antipyretic with a poor anti-inflammatory action. First one, para-aminophenol derivative. Okay, paracetamol. First one, C. Next, pyrazolone derivative, that is A, metamizole. Next, benzooxycontin derivative, nefopam. So, what is the correct option? First one is C, where it is B and C option is there. Second one is A. Okay. So, the correct one is the B option. First one is C, second one is A, third one is B. Next one, antidiuretic vitamin which will affect the nerves. Okay. So, B1, okay, this is a particular vitamin which will have an antidiuretic effects on your body. Next question, FMN and FAD. FMN means flavin mononucleotide. Okay, FAD means flavin adenine dinucleotide. These are the coenzymes forms of which vitamin? Okay, so out of this one, the correct answer is the B2. That is the option C. Next, burning feet syndrome deficiency is seen in which type of vitamin? Okay, B5, yes. B5 yes, B2 no, B6 no, and B1 no. Okay, so the correct option is the option A. Next, alkaloids are compounds obtained from the plant and animal sources. So, in this one, which type of a ring will be present? Acidic nitrogen containing? No. Basic nitrogen containing? Yes. Acidic sulfur? No. Basic phosphorus? No. So, alkaloids are the basic nitrogen compounds. If you see in this structure, they contain the nitrogen moiety. Okay. Option is B. Next one. The alkaloids that are derived from amino acids and do not have nitrogen in a heterocyclic ring. They are alkaloids, but they do not have a nitrogen. So, what is the name given for that particular one? True alkaloids typical? No. Proto-alkaloids? Yes. Pseudo? No. And another one, false alkaloids? No. So, the correct option is a proto. They are alkaloids, but they do not contain a nitrogen, are known as proto-alkaloids. Next one, example of a alkaloids containing oxygen and are solid in a nature. So, in their structure, in this particular drug structure, they contain a oxygen as well as they are, if you see, they are available as in a solid. So, the correct option is the atropine, that is a B. Next one. Which type of immunity is induced by vaccination with a live attenuated vaccines? Artificial passive immunity? No. Natural active immunity? No. Next, artificial active immunity? Yes. Next, natural passive immunity is a wrong answer. So, the correct option is the option C. Next, under the Pharmacy Act 1948, who is responsible for the registration of the pharmacist? Okay, so who is responsible for the registration of the pharmacist? State Pharmacy Council. All these are direct questions, so there is no explanation required. Which of the following isn't included in the demographic process? Okay, so which is not included whenever you are going to do this type of studies, regional or locality studies, which is not included? Morbidity is not included, that is the option A. Next, which of the following packaging material is to protect the drug content against the light? Okay, so if everyone are familiar, mostly transparent material containers will be used. If you want to protect from your light, you can use a ambered colored containers. So, where is ambered colored glass containers? Option B. Next, bubble test is used as a quality control test. For which type of a packaging bubble test will be done? Okay, blister packaging, yes. Plastic container, no. Glass container, no. For the sachets, no. So, blister packaging, bubble test will be done for the blister packaging. Next, which of the following is not a process involved in a glass production? So, if you want to prepare any glass shape, so which is not involved? Which step is not included? Forming and shaping is included. Extrusion is not. Heat treatment is okay. Finishing is okay. So, which is not involved? B, that is a extrusion. Next, dash bones make up the cranium and bones make up the face. So, how many bones are present in your cranium part and how many bones are present in the face part? So, you have to identify. 7 cranial and 12 facial, no. 8 cranial and 12, no. 7 cranial, 14 facial, no. 18 cranial and 14 facial. So, there is no explanation. You have to by heart the number of bones. In whole body 206, in the cranial part 8, in the face part 14. Next, which is the smallest facial bone in your whole body? Okay. Lacrimal bone is the smallest bone in your body. Next, which of the following is not suitable as a post-coital contraceptive? Okay, you can see the difference. It is not included as a post-coital contraceptive. Levonorgestrel, no. Next, levetiracetam acetate, no. Mifepristone, 10 to 25 mg, yes. Next, mestranol, no. Okay, so this particular drug, it will prevent your post-coital process. Next, pregnancy test kits are designed to detect which hormone in your body. Urine, you will collect it and you will test it. So, it will detect which hormone. There will be only presence of some particular hormone during the pregnancy. Okay. So, what is that one? HGC, human chorionic gonadotropin. If this hormone is released, then the test will indicate positive. If this hormone is not there, then it is negative. Next, what is the function of a copper T? So, copper T basically it is an intrauterine device or IUD. It stops obliteration of the blastocell, no. Checks mutation, no. Stops fertilization, yes. Stop zygote formation. So, this will inhibit the fertilization process, copper T device, which acts as the intrauterine device. Next, assertion type of question. Human has a dialectic skull, yes. Reason, skull articulates with superior region of the vertebral column with the help of two occipital condyles, okay. So, it contains this one, and coming to the reason, it is connected with the help of two occipital one. So, coming to the options, both A and R are true. R is a correct explanation of A. Next, both A and R are true, but R is not the correct explanation of A. A is true, R is false, both are false. So, the correct one is yes. Both statements are correct and the second statement is giving a correct explanation of the first statement. Next, one among the following is not an osmotic diuretic. So, out of all the options, okay, urea nitrate is not an osmotic diuretic. You can see the structure here also. Next question. One of the following diuretic acts on the loop of an Henle. So, out of all this one, itacrinic acid, this particular one will act on a Henle of loop. Next, thiazides are the most frequently used diuretics for treating hypertension. Yes. They lower the blood pressure by what is the mechanism? Decreasing the intravascular volume, correct. Decreasing the peripheral resistance by direct action on the vascular smooth vessel, yes. Decreasing the responsiveness of the smooth muscles to the noradrenaline, correct. So, all the options are correct. That is the option D. Next, full form of PTC. So, PTC is nothing but Pharmacy Technical Committee is known as a PTC. Next, Pharmacy Therapeutic Committee, that is a, sorry. Okay, the option is B, Pharmacy and Therapeutic Committee. Next, PTC includes, so how many members should be included in that particular committee? 3 doctors, 1 pharmacist, 1 nursing staff and the hospital administrator, correct. 2 doctors, 2 pharmacists, 1 nursing staff, it is not required because only 2 doctors are for 2 pharmacists, not required. 2 doctors, 1 pharmacist, 2 nursing staff, no. 3 doctors, 2 pharmacists, 2 nursing staff. So, this is the ratio. 3:1:1. Doctor to pharmacist to the nursing staff and the administrator. Next, drug utilization in Drug utilization in PTC do not involve prescribing, dispensing, administering and selling. So, the correct option is selling, D option. Okay. So, coming to the 63rd question, drug utilization in PTC does not involve option A prescribing, option B dispensing, option C administrating, option D that is a selling. So, the correct answer is selling is not involved in this particular PTC 1. Next, which of the following oils used as a vehicle for the oily injectables? Okay, out of all this, arachis oil, linseed oil, castor oil and jojoba oil. So, out of this one, arachis oil, if you see, it is used as a vehicle for only the oil type of an injectables. Okay, biological name of honey, whatever you use honey in your household. So, what is the biological name? Ovis aureus, no. Astragalus gummifer, no. Echinacea purpura, no. Apis mellifera, option D. Okay, so this is a correct answer. This is a biological name for the honey. Next question. Dextrine is produced from, okay. So, dextrine is produced from hydrolysis of agar, hydrolysis of a starch, acid treatment of a honey and reduction of the starch. So, the correct one is the reduction of a starch. Next, following are the methods for the isolation except, okay. So, streak plate method, no. Pour plate method, no. Indirect transfer technique, yes. Single cell isolation, no. So, the correct answer is the option C. This is the method, means all will be used. This method will be not used. Next, if stain appears as a deep violet or the purple black, then they are called as which type of a bacteria? So, gram-negative bacteria. If it occurs pink, then it is a positive. If it occurs purple or the violet, then it is known as a gram-negative bacteria. Next, match the following bacteria to the diseases produced. First one, Staphylococci, localized lesions. Next, E. coli, urinary tract infection. Next, 3, Streptococci rheumatic fever. Next, Shigella fever 1. This will cause a dysentery. So, first one B, next second one A, third one D, fourth one C. So, the correct option is A. Oral contraceptives are 100% effective in preventing pregnancy when taken orally, and they are also provide protection against the sexually transmitted infections. So, the first statement one is correct and the second one is correct. Okay. So, contraceptives are effective in pregnancy, yes, and they also provide protection against the sexual transmission. Okay. So, coming to the what is the correct answer for this question, 78th question, that is the option D. The first statement is false and the second statement is true. Is it correct? A patient complains of morning stiffness and the pain in multiple joints that improves with the activity. What is the most likely diagnosis? Pain in joints. If there is a pain in a bones, osteoarthritis. If there is a pain in a joints, then it is a rheumatoid arthritis. So, the correct option is B option. Next, hypertension is a condition where the blood pressure is consistently above 140/90, yes, and it often leads to the complications such as heart disease and stroke if left untreated. Okay, so hypertension, yes, 140/90 is a correct value, and if you are not controlling, if you are high BP, then it will lead to the heart disease, it will affect on the heart and ultimately it will lead to the stroke. So, coming to the option, both the statements are true, both the statements are false. The first statement is true and the second one is false, and the first statement is false and the second statement is true. So, the correct one is option A, both are correct statements. Next, match the following pathophysiological conditions with their characteristics. First one, rheumatoid arthritis caused by the autoimmune reaction which will affect the joints. Primary hypertension, high blood pressure, age related. Next, high blood pressure with no specific cause. D, 1A, 2D. Secondary hypertension. So, where is the other? This one. Next, leftover osteoarthritis, age related wear and tear of the joints. Bones in joints, there is a correction. So, the correct option is the option A. Next, what is the primary difference between the creams and ointments in terms of their base composition? Okay, first, creams have high oil content than ointments? No. Creams have higher water content than ointments? Yes. Ointments are water based while creams are oil based. Ointments evaporate more quickly than the creams. So, what is the primary they are asking? If you see, there are the minor differences, but what is the primary difference between the cream and ointment is, creams will have more water content than the ointments. Next, pastes are semi-solid dosage form that contain high concentration of a powder materials and they are more absorptive and less greasy than ointments. Okay, so whether these two statements are correct, you have to identify, or one is right or one is false. Both the statements are true? No. Next, both the statements are false. The first statement is true and the second statement is false. The first statement is false and the second statement is true. Okay, both the statements are true. Out of the 4 options, the correct answer is A. Next, a patient requires a topical formulation that stays on the skin longer and provide a protective barrier. Okay, topical preparation they are preparing and it stays for a longer time and it also protects your skin. So, which type of a formulation which will be most suitable? So, creams, no. Paste, yes. Lotion, no. Gel, no. So, the correct option is the paste. Next, match the following with their formulation and characteristics. First one, cream. Water based, thick and stiff, greasy and occlusive, clear and quick drying. Coming to this one, first one, A. Next, paste. They are thick, stiff and provide protective barrier. Yes, 2 is B. Next, ointment. Coming to the ointment, greasy and occlusive, direct match here. Fourth one is D. So, the option is A. Next, the Pharmacy Act 1948 was enacted to regulate which of the following? The sale of medicinal drugs? No. The profession of pharmacy? Yes. The manufacture of cosmetics? No. The sale of poisons? No. So, the correct answer is the option B. Next, the worst case time complexity of AVL tree is better in comparison to the binary search tree for. So, what are the options given here? Search and insert option? No. Search and delete option? No. Insert and delete option operations? No. Search, insert and delete. So, these are the correct option. The correct one is option D. Next, last question, high level knowledge which relates to the use of sentences in different contexts and how these contexts affect the meaning of the sentences. First one is morphological, no. Next, second one is syntactic, no. Last one is semantic, no. So, fourth option is the pragmatic. So, this is the correct answer, that is the option D. Okay. So, practice regularly, and if you see in case of your competitive exam, mostly there are only direct questions. There is no indirect questions. So, by heart it, or you study some important points from the textbooks or the materials which will be given by you, given to you. So, thank you everyone.